Hi, my name is Dr. Abel. I'm one of the pediatric endocrinologists at the Children's Hospital of Wisconsin. Today I'm introducing Maggie. She has type 1 diabetes and I'll be interviewing her today. Maggie, can you tell us how you were first diagnosed?
Absolutely. I was 2.5 years old, so I was a very young child, and my parents had asked before my mom even got pregnant, because my dad has type 1 diabetes as well. My parents had asked the pediatrician just before I was born, what signs should we be looking for? Is there something we should be concerned for our child having type 1 diabetes, and let's be cautious, because that could be a risk that one of their children could be diagnosed with diabetes. So when I was 2.5, my mom had noticed that I had been fully potty trained and I had wet through a diaper and a pull-up that I had been wearing at night, just in case. And she was like, that was very odd. And then the next day I asked for water. I never asked for water. It was always like, I want milk, I want juice. So that asking for water then just triggered her to say, we need to test a blood sugar. We need to see what's going on, because these are symptoms of diabetes.
Maggie, how does diabetes affect your life?
So one morning, my dad on Saturday mornings, we like to go get donuts. So we went to Dunkin' Donuts or something like that. I think it was Dunkin' Donuts, yeah. We're driving in the car and I start acting a little weird, and he's like, oh gosh, I think she's having a low blood sugar. So he's like, well, we were almost at there, and she's like, I'm sure she wants a donut. Well, I had already eaten, and I didn't want a donut. So I was like, no, I'm not eating that. And Dad's like, yeah, you have to eat this. Like, you have to eat something. So then he buys like a donuts, and then he buys like a juice, and he's like, you have to eat something. And he could not get me to eat. I was just like, I'm not putting that in my mouth. Absolutely not. And so he is freaking out. He's driving home, and he's like, your mother has to deal with this. So that's just one of the circumstances where it really can affect what's going on in your life, and trying to be prepared as possible. But is it reasonable to deal with a little kid that doesn't understand why they need to eat food when they don't want to, right? So when I started to become a teenager, you kind of start lying. People with diabetes are good liars, let me tell you. Because they're going to tell you what you want to hear, because they know what you want to hear. So when you're a teenager, I was just like, not a big deal. So I kind of got away with it a little bit. My A1Cs did start to climb a little bit more into the 9 and 10%. And then when you go away to college, I went to St. Louis University, so I went away from home and far enough away that I didn't have to tell anyone what my blood sugar numbers were. I didn't have to worry about that. So I basically stopped really checking my sugars as much as I should, even in general. I think there was days that I would go without checking my blood sugar numbers. And I had gone down for a weekend to go and see my friends in the summer. Well, I forgot all my insulin at home. You don't think about the consequences. So in that case, I was like, well, I'm invincible. I'm a teenager. I'm fine. Like, no big deal. So I went about 2 full days without any insulin. And on the morning of the 3rd day, I started throwing up. And I was having a lot of issues with, I couldn't keep anything down. I was very sick to my stomach. I had been going to the bathroom all the time. I couldn't, and I was still going even though I was so dehydrated. So one of my girlfriends actually drove me the 6 hours back home. That was a really eye-opener, to say the least, in a very point where I realized something has to change.
So clearly diabetes has had a really huge impact on your life. Since those teenage and college years, how has things changed in your life?
Well, I have been involved in research since I've been very young, and I've been very lucky to be involved so highly in research, as well as some of the organizations that are out there as well. So when I did do some research in my college years, unfortunately, when I went and got we did a physical exam, they looked at my heart, and they did some pictures of the backs of my eyes. On a yearly basis, I've been getting my eye exams, and nothing had really been happening, but they actually did, during this eye exam that I did have, they found macular edema, which is because of retinopathy due to my bad blood sugar numbers. For the course of many years, my numbers were definitely running, over 9%, and that's going to cause some complications, and so that's the big complications that I've had because of diabetes. And since then, I've actually had to have 3 separate surgeries for my eyes because of retinopathy, where they're doing laser to relieve some of the pressure that's from the backs of the eyes. eye disease it's a lifelong thing that I've now given myself, and I will have to continue to get surgeries, and there will be changes in my eyes, and that is a big concern that I will be blind someday, absolutely. So I do have to make sure I'm still kind of monitoring for those types of things at this point in time.
So Maggie, having gone through this eye experience and these procedures, it sounds really scary, and it feels like you've had a lot of reflection on what this has done to your life.
I'm really lucky now that I have a continuous glucose monitor that records my blood sugar numbers 24 hours a day. I'm always alerted if I'm above a certain number or below a certain number. I use an insulin pump to control my blood sugar numbers to make my day-to-day better. I've learned how insulin works in my body. I've learned that I need to give insulin 20 to 30 minutes before I eat so that I can make sure I don't have a spike after I eat. So from my carbohydrates, I need to get that insulin on board sooner than before I eat so that my numbers can stay stable, so my A1Cs are good, so I don't give myself any more complications, because I never want to have that surgery again.
How has diabetes impacted your family and friends?
Well, diabetes takes a team. You can't do it alone. I truly believe that it is a blessing in disguise. I think that out of my siblings, I was probably the one that my parents are like, thank goodness it was you, because I've really taken a positive outlook on the disease in general. But leaning on the people in my life has been extremely important, because as my dad being a type 1, he's been a great support person. But you have to know that you can't do this disease alone, because there's so many different pieces and factors to it. My mom was a big believer in that it should never hold you back, and I could do whatever I wanted in life. I was involved in every sport that she could put me in. She never let me not eat something that I didn't want to eat. If I wanted that extra slice of cake and everyone else was eating it, she was like, I'm not going to let her not have that cake. We're just going to have to do a little bit of insulin extra so that she can have it and she can be a normal child like anybody else. My friends are very supportive, and they're always there for me. They always ask questions. They're like, okay, what do you need? Can I give you a low blood sugar treatment, or how can I help? So it's nice to have that support and be able to communicate with the people that are closest to you about your diabetes as well.
So it sounds like diabetes has had a huge impact on your family and friends. Have you seen it had any impact on dating?
Yeah, it definitely is a hard conversation because there's so many stigmas around diabetes. So it's not something that I really mention right away. Not that I'm ashamed of it. I am not ashamed of my diabetes, but I do feel like it is something that eventually I will have to tell someone. I was on a first date one time, and I actually accidentally put my whole device, so my pump with my alarms, into my bra. It started alarming from my bra, and I was like, I had to pull it out, and he was like, what's that? And I was like, well, and that started the conversation a little bit. So, there's those kind of things. I have devices that I wear on my body. So it kind of changes the way that you look at your body or how someone is going to look at you. I was lucky enough to be in a relationship at one point that he made me feel comfortable that I could wear these devices on my body and still be me and not change how I look or perceive myself, which was a very good thing.
Maggie, if you could change one thing, what would it be?
I think that's a really hard question, because I am lucky enough that diabetes has led me into my current role as a nurse in the diabetes clinic. It has really made me the person that I think I've meant to be. These little factors that have kind of been presented throughout my disease and throughout my life, I wouldn't be where I am today if I didn't have diabetes. Now, it doesn't mean that I don't hope for a cure someday, of course, but it is something that I'm lucky that I've been able to shape who I am because of my diabetes. If there was really one thing that I really could change, was probably the size of all the devices that I do wear. I'd really prefer them to be just a little bit smaller. I know they're working towards it, but we're not quite there yet. So, there's still some big devices that I have to carry with me sometimes.
What challenges do you face with diabetes?
There are numbers that you can't always explain. There can be numbers that are going to be a little bit higher than you'd like them to, or a little bit lower on days. Does it relate to exercise? My body, for me, if I exercise 24 hours later, I can see actually an effect from a low blood sugar. And some days I hate the disease and I'm like, I don't want this anymore. I'm so sick of it. And sometimes you get really sad about it and you just, those emotions you're gonna go through them. I mean, it's part of the coping, dealing with the disease in general, but I found this person that I was following once and they had this great, just little saying of what I could relate to. And it said, and it's a picture of like some lines, and it just said, there's an I am greater than my highs and my lows. And I actually got a tattoo of it because it really means a lot to me because there's so many ups and downs that you go through even on a daily basis. So how can I make sure that I'm controlling my numbers? And when I look at it, I'm like, yes, like I can do this. Like I'm greater than my highs and my lows. This isn't going to define me. I'm not gonna let this disease define me.
Maggie, what do you think one of the biggest challenges you might face?
I think the biggest one is probably seeing that my dad felt guilt about my diabetes, and the possibility of me passing it on, I think, is probably one of the biggest concerns for me if I have children. And I do think it holds me back a little bit because, you know, diabetes and working in it and dealing with it every day already, and then seeing the challenges that the families go through, the challenges that my parents went through and me as a person have gone through, you know, it's not an easy life, you know, and not that everyone has an easy life, absolutely, but, you know, this is something that I think is one of my big concerns, because you don't know if you're going to give it to your child, if they're going to be able to do and live the life that I've lived. So I think that is one of the things that I'm really worried about.
So obviously diabetes has a big impact on your mental and emotional health. In what other ways do you think it affects you?
Well, I'm very lucky. The amount of people that have diabetes are really depressed about it. And I kind of took the bull by the horns and I was like, this is, you know, you got to be able to accept the disease. So I've really never had an emotional time that I've gone through with depression with diabetes, because I've really just been able to accept it as part of my life and be able to know I can get through this. Again, kind of off my tattoo, you know, I'm greater than my highs and my lows.
What are the financial impacts of having type 1 diabetes?
Diabetes is a very expensive disease. Let's think about what are all the supplies that you need. I need a meter that is testing my blood sugar number. I need tests for that meter. I need lancets to go into the poker for my meter. I need my insulin. If you're on 2 types of insulin, you've got one and then the other. I need glucagon. I need ketone strips. I need syringes and needles. For an insulin pump, I need my insulin pump supplies. I need to order my continuous glucose monitor supplies. To upgrade to a pump right now that I'm looking at, it's out of pocket $1,000. With insurance, it's still $400. So I need to make sure that I have some type of plan in place so that I can get this all covered for and have good medical insurance. Look at my father. He is not on, he owns his own business, so he's paying $3,000 a month for health insurance. Then you're paying $1 per test strip. That's $200 if you're checking your blood sugar 6 times a day, a month.
What are some ways that you've overcome the costs of diabetes?
You need to know that there's savings cards out there to try and save your patients the money, and for me it's saved me a ton of money every year to have these savings cards. You also have to make sure that you know your insurance plan and how it's working and how you have to know the system. Am I doing the right thing for my insurance? Is this the right drug that I need? What drug do I need to be on? What test strips are covered through my insurance? You know, if there's a prior authorization that's needed, people with diabetes need to know what a prior authorization is, because if they need to change test strips, if they need to change the type of insulin that they're on, knowing that there's different options to go about before kind of just doing that prior authorization to get that stuff approved.
What symptoms do you have with the highs and the low blood sugars?
With high blood sugars, it's usually, I kind of had said before, I get a little sassy, you can have mood changes and things like that, but mostly it's the thirst. You kind of can feel thirsty, and so you're wanting to drink all the time, going to the bathroom. I have kind of depleted all my glucagon stores, you know, with how long I've had diabetes, so I don't really feel my low blood sugars very often anymore. It's kind of when I start seeing stars, as I say, and it's just like my vision gets a little bit off. People can tell when they start talking to me, they're like, oh, you're either talking a little too fast or you're sounding a little confused and things like that. Unfortunately, I have gotten to the point where I've passed out from diabetes and I've needed glucagon before. So, it can be a very scary thing if you're not watching those numbers all the time. And that's why it's so nice with all these devices nowadays that can alert you to these low blood sugar numbers, especially for kids that are so young with diabetes.
Do you feel like people who do not have diabetes understand this at all?
No, I just don't. It's not something that you can explain. It's something that you're going through so many different emotions when your blood sugars are high, when your blood sugars are low. Having to just take a minute every once in a while to not have to, know how my emotions are at, or, to be like, you know what, I'm sorry, I'm very crabby right now, or I'm sorry, like I just can't. I need a minute. I need to treat my low blood sugar, and then I'll be back at it in 15 minutes. I think the only real place that I really truly feel myself, or that people understand me, is at diabetes camp that I love to volunteer at now, and I used to go to as a kid. But with everyone with diabetes, if I ever meet anyone with diabetes, I'm automatically like, we're best friends. I mean, the other day I was at a gala and I saw somebody wearing a continuous glucose monitor on their arm. I didn't know her. I went up to her and I was like, oh my gosh, you're wearing the Libre. I was like, we're best friends. We have diabetes together. So, there's all those little things that you can really relate to someone with diabetes, because it is such a special disease that you don't know what kind of emotions people are going through. And so it's one of those diseases that I just don't think other people can understand.
Do you have any advice for those viewing this interview today?
I think the biggest thing is that you have to look at a patient as an individual person. And I don't think that there's a really way that you can do that unless you have to be a person yourself. You have to have compassion. And I think having compassion towards someone that has a chronic disease is a really important piece of them relating to you and them wanting to open up to you. So if you can show that, and if you can have that emotion, then you're gonna get to where you need to be with your patients.
Maggie, thank you so much for telling your story and taking time with us today. We really appreciate it.
Yeah, absolutely, no problem.